it rains, everything just gets power, everything just gets
fine.
money.
That's fine. Yeah. Elise, is everyone okay? Yes. Can we start?
Yes. Okay. So do we have all the participants on? We are ready?
Yes, we are ready. We will start, and as we continue, people will be joining, I guess.
Okay.
Yeah.
All right, I think we can start. So
yes, good morning, everyone. I'll just yeah, my name is Sa Benjamin Traoré. I am the project coordinator for ACCA. For those who don't know, ACCA stands for the African Coalition for Corporate Accountability. And it gives us a great pleasure to welcome you this morning, this afternoon for this session that will be dedicated to the equitable distribution of the COVID-19 vaccine. We will be discussing about some specific issues around this very hot topic. I would like to welcome all of you to this session. Thank you very much for attending and being part of this conversation. I would like to especially thank our panelists for making time for this. I know you are all very busy. We have an incredible panel, and I'm sure that our discussions would be very valuable. I would like also to extend my warmest thanks to the Center for Human Rights, the host institution of ACCA, and especially to thank Dr. Nkata Murungi, who will be moderating this session. So before giving the floor to Nkata, I would just like to bring to your attention that we do have simultaneous interpretation. So you have the icon on your screen beyond, and you will see the French, especially the French channel. Bon, pour ceux qui sont francophones dans l'audience, je disais que nous avons...
For the ones who are French speakers, we do have simultaneous interpretation from French into English and vice versa. You'll just need to click on the icon interpretation at the bottom of your screen, and you will see the icon, and you can select the French so that you can follow that into French or English.
Thank you very much.
Okay.
Can you hear me, Nkata?
Yes, I hear you. Okay, so I can proceed now.
Yes, please.
Okay, all right. Greetings, everyone. I think I should stop saying good morning or good afternoon because we have people from everywhere. Welcome to this webinar. It's a pleasure for me to host, to moderate this session. And as Benjamin has said, we are very, very grateful to the panelists who have made themselves available to assist us with this discussion. As you know, that the discussion is going to be focused on COVID-19 vaccines and the new global, the topic basically is health versus profit, COVID-19 vaccines and the new global apartheid regime, more of a question. And what we are looking at is the increasingly relevant conversation regarding access to vaccines and the intersection of that with human rights across the globe. I should believe that the rest of us across the world have been following with keen interest developments related to COVID-19, as well as the subsequent conversations around access to vaccines. And particularly in the African region, I think there is concerns about equity of access. At what point do poorer countries or countries in the global south get adequate access to these vaccines? and what kind of intellectual property issues arise in relation to sharing of knowledge and materials related to access to vaccines. So this conversation is something that is not only relevant, but is also of great significance, and or at a time when it is absolutely at the forefront of all of our concerns as a region, as people working in the human rights sector, as well as people generally working in the business and human rights sector. I would believe that there's nothing as more relevant to bringing or to bridging conversations between the business sector and the human rights sector as this moment that we have now. I have a very prominent panel to introduce who will be speaking on various aspects of this topic. And so I will proceed to just introduce the panelists very briefly. They are all accomplished professionals with long CVs that I may not get into. I will just briefly introduce the panelists and what they'll be speaking to. And then I will request that we please give them the time to speak. They will have 15 minutes to speak. We will go through all the panelists' presentation. Afterwards, we will take questions and discussion. I would also advise that if you have a question, that you put it on the chat. We will note the questions in the chat, and we will then put them back to the presenters once the discussion time has come. So without further ado, I would want to introduce our first panelist, who is going to, okay, I will introduce the entire panel, then I will ask each of them to speak. The first panelist that we will have is Professor Franziska Sucker from Wits University in South Africa. She will be speaking on understanding the TRIPS agreement and the petition made by South Africa and India in relation to the COVID-19 vaccines. She's an associate professor at the School of Law at University of Wits in Johannesburg, and she teaches courses in international trade law, public international law, and at both master's and undergraduate levels. Franziska is also the co-editor of the book on Perspectives and Priorities of Southern Africa in International Economic Law, and a visiting research fellow with the World Trade Institute, as well as the South African Institute for Advanced Constitutional, Public and Human Rights and International Law, which is in short CIFAD. Our second speaker will be Mark Hayward, who is the founder of the Treatment Action, co-founder of the Treatment Action Campaign, as well as Section 27. He's going to be speaking on the South African experience with ARVs in the early 2000s and the issues related to intellectual property rights that arose in that context. Mark has extensive experience of constitutional litigation to realize rights, including the Hoffman, Tack, and Dudley Lee cases, as well as tax alley cases challenging the lawfulness of excessive pricing by pharmaceutical companies. I believe that we'll be getting a lot of experience, informed opinions from Mark in this regard. Our third speaker will be Alana Kembavazi, who is a program manager with the Institute for Socioeconomic Rights in Uganda. She'll be speaking to the collective strategies by African countries on vaccine distribution. Alana, as I have mentioned, works with the Institute for Socioeconomic Rights in Uganda. She's passionate about economic and social rights and is particularly interested in legal and policy frameworks. She's the head of the Right to Health program, which uses strategic litigation to advance the right to health in Uganda. She holds a Juris Doctor from Yale Law School and a bachelor's from the Wesleyan University in the US. The next speaker will be Mona Savela, who will be speaking about the overview, who will be giving us an overview of the private actors and pharmaceutical firms involved in this COVID-19 vaccines. She will be, sorry, just a minute. She's currently the coordinator of ESCRnet, and which, as you may know, is a network that connects quite a number of organizations that lead efforts to regulate socioeconomic or other business activity and corporate accountability. It is ESCRnet, which you may be aware is guided by the work of social movements in advancing human rights and social justice for all. Mona has previously led legal research and advocacy on corporate accountability and colonial practices of dispossession impacting human rights in areas such as Palestine. Soon after that, we will have a presentation by Professor Surya Deva from the Asia Pacific representative, who is the Asia Pacific representative to the working group on issues of human rights and transnational corporations and other business enterprises. He will be speaking to equal access to the COVID vaccine and human rights obligations of pharmaceutical firms. Professor Deva is, give me a moment, has been appointed to, as I have already said, to the working group, and is an associate professor of the School of Law in Hong Kong. His primary research interest is business and human rights, as well as corporate social responsibility, as well as India-China law and sustainable development. He is one also of the founding members of the founding editors of the Business and Human Rights Journal. Without further ado, I think this, as you may agree with me, is a very prominent panel of people who are very versed with the subject that we have before us. So I would kindly want to ask you to please feel free to make your opinions and your presentation, and then we'll take questions for you. So to start us off, I would like to welcome Professor Francesca. Please, that you may proceed on your presentation. Thank you.
Thank you so much for the kind introduction and for inviting me. I hope you can hear me all right.
Yes, we can hear you.
Thank you so much. I was asked to speak on the TRIPS waiver proposal from South Africa and India. And understanding it is probably a bit difficult because many do not even understand the TRIPS agreement. But let me say quickly in the very beginning, as a reaction to what you just said, trade law will not be able to assist for equal access, just because that word did fall a lot. I think here we concentrate more on building manufacturing capacity to increase the amount of vaccines available or other technology, just as a disclaimer before. So that will not be ever achieved with the waiver. To understand it, maybe the TRIPS is a multilateral agreement within the WTO framework, which regulates trade-related aspects of intellectual property rights. Almost the only comprehensive one at an international level, and stipulates minimum requirements that each country has to fulfill in their domestic laws to protect intellectual property. And that is, so minimum says it already that one can go beyond, and that is also done by many of the developed countries specifically. So when we look at patent protection, which is the crucial aspect with regards to vaccines, then it's at a minimum of 20 years protection. And there is, however, the option that if in national law there is a compulsory licensing option regulated in national law, a government can issue a compulsory license. So that is where now the controversy of the TRIPS waiver comes in. South Africa and India have proposed such a waiver in October. They have actually done so before already in June in various meetings at the WTO, but they have then officially done so in October, which would suspend obligations that are stipulated in TRIPS. In other words, it would allow a country like South Africa or other countries to not grant IP rights within the country. In other words, to not make sure that patent protection is guaranteed for a specific company that has, for example, produced a vaccine, but only for a specific time. That means until the pandemic is under control, and not only for vaccines, that's important, but for every technology products that are related to the treatment of COVID-19. So that as a background. So why is that now so controversial? So there are many countries and many scholars who oppose this waiver and block actually actively in Geneva. That these are mostly countries who have already secured vast amounts of vaccines, countries that have not just vast, sometimes also 2 or 3 times the amount that they would require to vaccinate their population. What is the major argument why they block this waiver, and what can the waiver do? So the major argument is we have enough flexibilities in TRIPS for the current needs. That is the main argument. There are 5 others I will address, and that's why the question is, what can the waiver do what we can't do without it in TRIPS? So how would it help? So the reference is made to compulsory licensing. They can do compulsory licensing, but the compulsory license system in the TRIPS, and I keep that all very quick, brief, because I have this time, only 10 to 15 minutes, and it's otherwise too complicated. So the current compulsory license system in TRIPS does not cover trade secrets or cell lines. It's focused on patents only. So that's the first thing, and you need not only patent procedures to actually produce generics of the vaccine, you also need trade secrets and cell lines. That is a minor point, but not less important. The second major point is that the TRIPS compulsory license system requires an individual action. What that means is that a country can only produce generics for their own population, and is, if one takes the provision seriously, not allowed to export. From that perspective, it might sound reasonable, because one doesn't want a country to produce generics and then make profit themselves, or at least those companies. But from the perspective of capacity, a country might not be able to produce alone those generics, might partly be able to produce parts, and the other country that part. So these cross-border manufacturing is not possible with the current TRIPS system. At least collaborations are hugely hindered due to the requirement to only produce for the domestic market. Which leads to a third point, that is countries without manufacturing capacity at all would not be able to import generics where they're the cheapest. For LDCs, that is possible because they're exempt. But for countries who are not LDCs and have no manufacturing capacity, that is possible only if the country has ratified the latest amendment of the TRIPS, which was exactly around that issue. So the latest amendment, to make that short, was around countries without manufacturing capacity, that they can import generics to a cheaper price. But that was an amendment only with 2/3 of the WTO members, and prominent members who have not ratified that amendment are the US and the UK, which we know are hosts of one of the successful vaccines. So that would not apply to them then either, which is a big problem. And the last point on that note is, it's a very time-consuming and cumbersome process to actually issue a compulsory license. A time we might not have, for sure. It's already 1 year in that whole pandemic, but also requires long negotiations with right holders. There are uncertainties around what an adequate remuneration would be in terms of compulsory license, and all that is not clear. With a waiver that would not have to be adhered to, and we could just produce and use the patent. There are some arguments that says, but why don't you try first a compulsory license? For example, South Africa has not done so since 100 years. But there are actually examples where countries have tried it, and India is one of them, which faced huge sanctions or threats of sanctions when it was about the cancer drug from the US. The same example was for Colombia when it was about a leukemia drug with regards to issuing compulsory license there from Switzerland, and Malaysia very recently with regards to hepatitis C as well. So it's not that's not really a good argument to say try the compulsory license first. They have been done. Three more arguments that are usually done against the waiver. I'm looking at the time. We need IP rights to incentivize innovations and to recoup research and development. That is a bit tricky to hold here in this case because there are over 200 vaccines in development. There was a lot of activity, so there was no luck on innovation, and trying public government funding on top of it was added. So advanced purchase agreements we had, so there was not really so much difficulty for the companies to recoup their investments. On top of it, there's a huge global demand that is actually well above the, well beyond, this was the other way around, well beyond the actual production everywhere. So that is not only applicable to developed countries and developing countries, that's applicable to the whole world. So the global demand is not met. The fourth argument we heard is, but they don't have capacity anyway to manufacture. I heard that in a lot of webinars, specifically from WTO personnel in the last weeks, and that is, well, Fatima Hassan said to that very eloquently, but why don't you let us just try then first? You don't have anything to lose if we don't have enough capacity anyway, and if we succeed, then we can contribute to manufacturing what the world needs. I found that quite convincing because that is so. They are finally made some legal arguments. The request was not, so South Africa and India would have not demonstrated exceptional circumstances that are required for a waiver. Well, in their request, they have referred very often to the pandemic and the need of a global collaboration and manufacturing capacity building. If I look at other waivers before, they were never as exceptional circumstances as they are now. That is, of course, subjective, but there are also no definitions what exceptional exactly mean. If you look at the provision, and I'm a lawyer, that's what one should do first, is it doesn't say anything and doesn't define what exceptional is. COVID for me would be exactly that. There was also the claim made that it wasn't legally justified enough. It was phrased too broad for too many products, too much members, and unlimited. It's not unlimited, it's temporary for the time the pandemic is under control. And how it is exactly phrased is not the task of the request, it's the task of the actual draft of the waiver, which is currently just on its way. And that brings me to why it is maybe the best option. Pharmaceuticals could actually influence how the waiver is drafted and put in requirements instead of opposing it, and so other countries, because that is exactly the task. To what conditions, what are the requirements to actually waive the rights and so on, because the other option that is now pronounced also from the new DG of the WTO, the voluntary licensing, is a third option. It is nice that if it happens, but many countries cannot rely on it, in my opinion. So there are other ways needed. So the waiver would be #1 choice. As a closing note, the waiver will not solve that thing. The waiver will not solve that the countries have very little funding, that the countries have very little capacity. They will also not solve the government's failure of putting the right legislation into place. And they would also not solve equitable access, but they would at least be giving the opportunity to build manufacturing capacity across borders which in my opinion is needed. Thank you very much.
Thank you very much, Prof. You actually kept within the time very well. So I sincerely appreciate your brevity, but also the fact that you raise very concise and relevant issues, which I should hope will be picked up on as we go along in the questions and discussions. May I kindly invite Mark to please make your presentation?
Good day, everybody, and thank you for the opportunity to say a few words to this important webinar. And thank you too for, in your program, drawing parallels with the HIV/AIDS epidemic and the responses that were developed 25 years ago to the very same problems of access and affordability. And I have to say right at the outset that although the coronavirus and the human immunodeficiency virus are very different types of virus, and they behave very differently in certain respects, the issues around access and human rights are very, very similar. And for me, they act as a reminder that those issues that we tried to address 20 years ago remained unresolved. They didn't go away, although, as my presentation will show you, we were able successfully in some ways to address the access question in relation to HIV. But the broader questions around intellectual property, patenting, excessive pricing, monopolies, etc., around this aspect of health remained unbroken. So I want to start just by asking you, in fact, to take yourselves back 20 years, if you were around 20 years ago, and recall in the early 2000s how the AIDS epidemic was one of the biggest political issues of the new century, of the 21st century. And that had a lot to do with a mobilization by activists who had turned the HIV epidemic into a question about human rights and about equality, drawing attention both to the factors that created additional vulnerability to HIV infection, i.e. poverty and inequality, but also the factors that created additional vulnerability to AIDS, that is the illness that comes from HIV, which again was to do with poverty and inequality. If you had HIV and you were in a developed country, certainly by the early 2000s, the probability was that you would live. If you had HIV and you lived in South Africa or Botswana or Malawi, many other countries, the probability was that you would die. And you would die largely because the medicines that had proven efficacy were priced out of the affordability of your government or outside affordability even of private individuals if they were accessing health through private healthcare. And the reason for that was because since the mid-1990s, antiretroviral drugs, and there isn't time to discuss the process of their development, had become available in developed countries, but because of patents, were unaffordable in developing countries. And it happened to be the case as well that developing countries by the early 2000s and the late 1990s had become the epicenter of the global HIV epidemic. Countries like South Africa, countries like Swaziland, and so on and so on. So it presented us with this issue of, if you like, intellectual property rights versus fundamental human rights. And the context in which we established the Treatment Action Campaign in 1998 was that at that point, not one person was on antiretroviral treatment. In the late 1990s and early 2000s, there was only one middle-income country that was making antiretroviral drugs available to to ordinary people, and that was Brazil, because it had the capability and the technology, but also because it had the political will to challenge intellectual property rules, if you like, but also, as Francisca, I think, would agree, not to go outside of the rules of the TRIPS agreement, but actually to utilize the TRIPS agreement or aspects of the TRIPS agreement, to utilize those parts that the pharmaceutical companies in the developed countries would prefer developing countries didn't take advantage of. And the other country that was important in the equation in the early 2000s was India, which had built a generic pharmaceutical industry as an industrial strategy. And although there wasn't huge demand, there wasn't a huge HIV epidemic in India, say, compared to South Africa or Southern Africa at that point, India was acting, as we called it at the time, the pharmacy of the world, because of the fact that it was, again, prepared to exploit both the loopholes, but also the flexibilities in the TRIPS agreement in order, as a strategy, to encourage the development of its domestic generic pharmaceutical industry. Now, all of those factors combined to mean that access to medicines that were efficacious and were life-saving were out of reach of millions and millions of ordinary people in developing and in middle-income countries. I should also point out, just at this point of introduction, that although the focus was on antiretroviral treatment, this was not a problem that was exclusive to antiretroviral treatment. Those of you who have been, who understand HIV know that HIV, in the course of people's weakening of immune systems, they become susceptible to opportunistic infections, fungal infections, and so on. And what HIV exposed, that there were also drugs for tuberculosis, for candidiasis, etc., which were way beyond the affordability of developing countries because of the way that patent rules were used to permit excessive pricing of those medicines. I think of a medicine, for example, called diflucan or fluconazole, which was a medicine for thrush, which in Thailand we could buy for about 10 Rand per tablet, but in South Africa cost 150 Rand per tablet. And the reason was because it was produced generically in Thailand, but was patented in South Africa. So what HIV did was that it shone a spotlight on pharmaceutical company practice at a time when, as Francisca has just explained, the TRIPS agreement had been used to raise the bar of intellectual property protection all over the world. And the consequence, one of the first consequences, was going to be access of people to their right to healthcare services. And I think the sad thing to say is that today we are seeing a very similar situation in relation to vaccine access. It's almost a replay of the issues that were fought out in the early 2000s, but as I said, were not resolved in the early 2000s. So if you were to read an article in the New York Times yesterday about vaccine access globally, you would see a report that said that residents of wealthy and middle-income countries have received about 90% of the nearly 400 million vaccines that have been developed so far. And there's a very useful vaccination tracker on the New York Times website, which, if you look at it, you will see country by country how developing countries, countries in Africa and so on, are flatlined. There is no vaccine access in most countries of Africa. Even in so-called middle-income countries like South Africa, I think the figures of vaccinations now are in the region of 150,000 or 160,000 healthcare workers only. There is no vaccination of the population as a whole, or even of those groups that we know have a high vulnerability to COVID-19. So we're facing exactly the same set of challenges. And I think in many ways, we're facing exactly the same set of rules and laws and excuses from pharmaceutical companies, which are used to create a fog of confusion as to what is the real reason why people are unable to access these life-saving medicines. Now, I want to spend the remaining 7 or 8 minutes of my presentation just talking about how did the treatment action campaign overcome these obstacles, or perhaps the question, did we overcome these obstacles, or did we get a temporary victory, but we won the, what's this, we won the war but lost the battle, or whatever the saying is. But I wanted to talk a little bit about how we built a movement to address this question of access to treatment. And what I want to stress is that for many of us from civil society, I think it's exactly the same with COVID as it was with HIV, which is there's a need to act urgently, but to understand that you're running a marathon, to think long. So acting urgently does not mean that you can take shortcuts in how do you build a capable movement to challenge these inequities. And in preparing for this presentation, I identified really 5 things, and there isn't time to talk to any of them properly, that the treatment action campaign took on to try to tackle these laws. And they were building from below. I'll say a little bit about each of them. Building international solidarity and collaboration across borders with other activist and civil society organizations. Organizing a social mobilization around human rights as juxtaposed to intellectual property rights. Making the law through litigation, i.e. giving content but also clarity to intellectual property law. And then finally, I would say breaking the law where necessary, where that law was unjust or where that law was contrary to fundamental human rights principles. So just briefly on each one. On building from below, I think that these questions that we're discussing today are not just questions for academics or academic discussions. They are questions for society as a whole. And so it becomes very important, given the fact that COVID-19 is a threat to millions and millions of people, that people are empowered through education that develops understanding about the vaccines, understanding about the companies that produce the vaccines, understanding about the processes that led to the development of the vaccines, and understanding about the abuse of markets and profiteering from these vaccines, which were envisaged at the outset as public goods, were developed largely with public money because of public need, but which have been privatized for the purposes of marketing and distribution and are now treated as goods, privatized goods for the privileged few, or at least for the privileged countries. So basic literacy and understanding around vaccines is critical. The second thing is international collaboration. I think that speaks for itself. The third thing, social mobilization around fundamental rights, links to this question of how do we make the law. In South Africa, we had 3 important court cases to test intellectual property law. One was a court case in the late 1990s that was brought by pharmaceutical companies to challenge our government's amending a law which allowed them to use compulsory licensing and generic substitution and parallel importation, all of which are permissible under the TRIPS agreement, but which the pharmaceutical companies gang together to try to prevent the South African sovereign government from exercising. And we won, perhaps you can ask about that in the discussion. We got the companies to withdraw that legal action. The second also was a case which didn't reach a judgment, unfortunately, but saved, I think, hundreds and hundreds of thousands of lives, which was a complaint that we brought before our Competition Commission, alleging that the excessive pricing by pharmaceutical companies was an abuse of market dominance, which violated fundamental human rights, particularly the right of access to healthcare services in South Africa, and therefore should be considered unlawful. And it's very important when you consider legal challenges to these to understand that this type of litigation has to be underpinned by evidence, by research, by documentation that shows you what was the process, what was the cost, that dispels, for example, some of the myths that Francisca referred to, that if you allow compulsory licensing, for example, that you will deter research and development because pharmaceutical companies only do R&D on the basis of the possibility of recouping massive profits. So law and litigation is partly a means to debunk some of these convenient myths that these companies use. And then finally, as I said, using things like breaking the law, we smuggled in one particular drug called fluconazole. I mentioned it already, because we said that it was better to break an unjust law in the interests of people's rights of access to life-saving medicines. Now, by breaking that law, we smuggled this drug in. We made it public that we smuggled the drug in, and the result of smuggling that drug in was that the company, the very same Pfizer, that now has one of the vaccines, offered to give the South African government this drug for free, a donation of $75 million, which again shows that these companies, when it comes to legal challenges, will do all sorts of things to reduce prices, to give the drugs away in order to not have to face a challenge to the legality of the way in which intellectual property rights are being abused, most often for sakes of perpetrating market dominance. Now, what I want to conclude by saying in relation to that is it's this combination of strategies that help to capture public attention and imagination, and which make access to treatment a human rights question and a moral question, and a human rights and moral question that assumed global dimensions. Now, what troubles me at the moment is that even though we have a global COVID-19 pandemic, I don't think that there is yet an understanding of that this is a global human rights violation that is being perpetrated on poor countries and developing countries in particular. And if we are going to get to that point, and it's only at that point that there will be pressure around things like the WTO waiver requests from South Africa and India, that we're likely to see progress. So let me just finish very, very quickly by saying, well, what did this achieve? And because one of the messages I want to make to you is that these so-called intellectual property rights are not inviolable. They can be challenged, and they can be challenged successfully. I think what we achieved, and this was not just in South Africa, this was what activism achieved globally in the early 2000s, was dramatic price reductions on these medicines. When I started work in South Africa, antiretrovirals cost 5,000 Rand per month, and we were told that was the cheapest price at which those drugs could be made available. Today, they cost about 100 Rand per month, the same drugs. In the early 2000s, there was nobody in treatment. That in developing countries. Today, there's 26 million people on treatment. We managed to get the issuance of voluntary licenses on essential antiretroviral medicines, mainly because of the threat of compulsory licenses. And I think that, Francisca, is one of the powers of a compulsory license is that it forces pharmaceutical companies to negotiate seriously, even if a compulsory license doesn't ultimately get issued. It was possible to bring about legal reform at both a national and an international level. We haven't mentioned yet the November 2001 Doha Agreement reached at the WTO, which clarified that compulsory licenses could be used in public health emergencies. Perhaps we can come back to that question, but it was an important pushing back against some of these laws and clarifying of them against human rights. And then finally, I would say that pressure led to institutional innovations that were intended in trying to mitigate some of the problems that exist because of pharmaceutical company practice and patenting. For example, the medicines patent pool, which although many people are critical of the medicines patent pool, was nonetheless an important innovation, the Global Fund on AIDS, TB, and malaria. So I'm going to finish because I'm out of time. I did want to say that having made those successes, I think that the problem that happened after 2000, I would say perhaps 2008, 2009, was that the pressure and the spotlight was taken off pharmaceutical companies, that there was a turn to health systems issues, which are very, very important. But just as you can't address access to medicines issues without health systems issues, you can't address access to health systems issues without access to medicines issues. And that allowed pharmaceutical companies to regroup and to reorganize themselves in certain ways to get away from the pressure that they had experienced in the early 2000s. So the question I guess we have to discuss today is, how do we address the vaccines crisis? I would say we have to build from below. I would say that we have to show that there are alternatives. We have to debunk the myths about production, about capacity, about price, at which these vaccines are priced. We have to gather the evidence. The situation is more complicated than it was with antiretrovirals in the early 2000s, because there are not generic producers at this stage, and therefore there are fewer alternatives on the market. But I still believe that there are pathways to vaccine access as a human right that can be reached through a combination of use of law and social mobilization. And I'll stop there. Thank you.
Thank you very much, Mark. Yes, you have gone a little bit out beyond the time, but I should hope that our colleagues coming next to please try and keep within the time, because we are also running a bit behind schedule. So I would invite Alana to please make your presentation, and I hope you can do it within the 10 to 15 minutes maximum. Thank you. Alana?
Sorry, I had forgotten to unmute the Zoom meetings. Can you hear me now?
Yes, we hear you. Please proceed.
Fantastic. So I just wanted to give us some, I'm glad that I'm following the prior presenters, because I think they've talked about the broader issues, and I want us to be able to now sort of look at some of the specifics in terms of how deprivation is playing out on the African continent and the limited options we do have to really handle the situation. So like you can see from the screen that I'm sharing, you know, while about only 1.7% of the African continent's population has been vaccinated. And you know, by June, just to give you some context, by June, the US plans to vaccinate 70% of its population. 67 countries in Africa are yet to receive a single dose. If we rely on Kovacs, which is the WHO mechanism, by the first half of this year, we'll only get, you know, they're targeting 3% of countries' populations. By the end of the year, if everything goes amazing, it will only be 20%. And these, again, are like the 67 countries that are yet to receive a single vaccine dose. Now, we've been thinking about efforts here. Of course, there's been Kovacs, which African countries have relied on like a savior, which has so many issues that may be beyond this conversation. And then we've seen bilateral deals like countries. So Uganda, for example, trying to have a deal with Serum Institute, South Africa, you know, just a lot of bilateral deals, as we'll talk about. I'll talk a bit about later why that is very problematic, in my opinion. We've seen the African Union come up, 670 million doses through the African Vaccine Acquisition Team, but countries only obtain that using advanced procurement guarantees through the African Export-Import Bank. MTN donated vaccines, about 7 million vaccines. It donated money to procure vaccines to the AU, which then plans to distribute to supplement Kovacs. Then, we're seeing countries beginning to donate. Donate is other countries, not African countries. South Africa right now has sold its AstraZeneca doses to 14 member states because they're no longer effective for the variant that is there. And then in terms of also regulation, we're seeing African countries trying to get together. So the Africa CDC has a regulatory task force to provide some of the guidance around approval and so forth, in addition to what's happening with WHO, and in addition to in-country efforts. But there are major hurdles. And like I said to you, the fact that we have a population of about 1.3 billion, we have a situation where we have very few vaccine manufacturers. And Francesca did talk about the fact that even if you address intellectual property, it won't necessarily bring about equitable access. And there are definitely elements to that conversation, but it is a significant first step, in my opinion. And we are looking at the few manufacturers that are there really focusing a lot on profit. The Pfizer meeting, for those who have watched those recordings, is very telling as they talk about the opportunities that are going to come as boosters come in. I mean, they're forecasting just how much more they're going to make. So Pfizer, Moderna, and Johnson have already told investors they're planning to hike prices, cash in on additional booster shots. They talk about third doses and where they'll make money. And 67 countries are yet to receive a single dose in Africa. And then even when it comes to things like countries have said, well, we contributed to Kovacs and we'll give you the doses because we have got an additional bilateral doses through our additional bilateral doses. But they'll only do that when they no longer need them. And the UK, for example, has said that. And there's a catch. They're saying we may need to pay for them. So there's been no solidarity at all. And when we think about the leverage we have when we are competing with so many wealthier countries to get access to these very scarce doses, the pricing is really problematic. I talked about countries having bilateral deals. Uganda has gone to say it paid $7 a dose. As an aside, ICE has filed an access to information request to make sure we verify that. But it's a low-income country. It is much higher than South Africa, which is, for example, is $5.75, much higher than the EU, which is $2. But when we expressed our outrage, someone said, you can't compare a small country like Uganda, which is only ordering so many doses. Like, it does matter. The size of the population matters. Let's look at what the AU is paying. It is $9.75 per dose for Russia's Sputnik jab. And this requires 2 doses. So you're actually talking like close to $20. And yet it's one of the biggest buyers for Africa. Sputnik is a key market for Africa is a key market for Sputnik. $3 per dose for AstraZeneca. The EU is paying $2, right? And like I said before, South Africa, Uganda have talked about how much they pay. When it comes to Pfizer, the AU, with its collective bargaining power, could only get $6.75 a dose. So you are talking slightly above $13 because you need 2 doses, and then $10 for Johnson. Johnson so far seems to be among the cheapest, following AstraZeneca, of course, a single dose. It completely failed to purchase Moderna because Moderna was $32, $37 per dose. Moderna has about $18 million in vaccine orders. It is swamped, and it plans to make more money. It has talked about it to its investors, particularly from the US, EU, Japan, Korea, sorry, the typo there, UK and US. We talked a bit about this business about voluntary licenses, and I'm glad the prior speakers talked about why this can be really problematic, but I think we can think about AstraZeneca and the Serum Institute as one of them. And we're not quite sure what's in this agreement. I would love to see this agreement, but my understanding is that whatever was being produced should have been about $3 a dose, but you're already seeing differential pricing. And again, this is just something which companies have control over. It has even more issues than compulsory licensing. And I'll leave that Francesca because we have very little time, and maybe we should speak a bit about it as she responds. But we're also seeing vaccines as soft diplomacy. So we're seeing donations from China and India, and they're being used to cement spheres of influence. So it's not about need, it's not about global health equity, it's just about how do I make sure that I make inroads in a country where I need you. So we've seen China donate 200,000 doses to Zimbabwe. China did, I think, donate some to Uganda. India has donated some to Uganda for sure. And I said, like before, other countries in Kovacs talking about donating doses, but only after they've vaccinated their population. So there's a lack of real choice for the ordinary African. First of all, it will be a while before the Africans that are not health workers or in the priority groups will get a vaccine, right? It will be years. And remember, there are variants coming up. And we are also, ironically, the continent that had the least prepared health system. We often have underfinanced, struggling health systems. So if this played out, we're not going to have the ability to quickly begin building hospitals of, and like, no, we are not. In December in Uganda, just a small spike, if you compare it to other countries, it's really a small spike, and no one could get ICU beds. A prominent doctor died. He worked in the hospital and he died because he could not get an ICU bed. But also lack of real choices. We have AstraZeneca. When concerns are raised about AstraZeneca, and every country was posing this, many countries like the African countries, actually the African CDC just say go ahead. It had to say go ahead. Those are the doses it has. Those are the majority of the doses it has. So whether, you know, as this is playing out, because now people are saying, well, AstraZeneca is safe, we're going to start again, and all of that, we don't have a choice. This is what we have. We're at the bottom of the pile. I like to say they're overpriced leftovers. That is literally what African countries have been fighting for. Overpriced leftovers, whose efficacy, when it's doubted, we have no choice but to continue, because what is the option for our population? Death. And think about what needs to be done. Definitely the support for suspending IP. This is for me, it's just very moderate. They have so much control over it. It's a no-brainer to me. And these countries that have been sidestepping the issue, like the UK, which said, if you remember in October, I said, it's merely hypothetical. I mean, Mark has talked exactly about what happened with HIV. He doesn't even have to say it. We live the reality. We are aware. We've buried so many people, so many relatives. I remember the first time I realized that there was a drug for HIV. It was like, later, it was like 2010 or so. I don't know why I didn't know, but I remember in the early 2000s, in my family, there was just a wave of people dying HIV for a little bit. And it was just inevitable. It was what happened then. And then you later on realize, no, it's not inevitable. This could have been avoided. The whole world just sat there, and this could have been avoided. Of course, beyond that, sharing the know-how is very, very critical. And that, you know, he's talked about the medicines technology access pool. So there's a COVID technology access pool. There are generic companies ready to go, but no vaccine company has joined. And then beyond these two proposals, which are really around increasing supply, because increasing supply is very critical, there are other issues like financing, and financing is a very critical issue. Financing to the last mile. How do you make sure, one, you can buy the vaccines, and two, you can vaccinate the population? And it takes a lot of money. So the nature of financing is really important. So let's see what's being said about financing. African governments can access a 2 billion vaccine facility by the Cairo-based Africa Export-Import Bank. We also have the World Bank, which has offered $12 billion as part of its broader pandemic support. This is in the form of non-concessional loans and grants. At least it offers a bit of grants, but the other one is really loans. And why are we offering loans to African countries that are at severe risk of debt distress? Some have already, we remember last year how it was falling out with a couple of countries, playing out with a couple of countries. We also are the continent where no one has access to special drawing rights. It's only now that we're seeing progress of the G20 in terms of really saying, let's increase special drawing rights, let's increase the allocation. But even then, when you think about what it will mean in practical terms for like each African country, that increment is going to be quite small. So we don't already have a lot of fiscal flexibility to deal with this crisis. Whatever little fiscal flexibility, we stretched it. We can't afford lockdowns. You are not hearing about everyone getting a stimulus check like we saw with the US and elsewhere. Whatever bit of money they were spending has already made the debt levels, like Uganda, for example, is now nearing crisis level, right? And we hope very soon we'll be exceeding 50% of GDP. And what does it mean when all this debt is there? It means that, say you borrow to vaccinate your population. You've been borrowing to help the private sector that has been struggling through this process, borrowing to buy PPP and all of that. You're going to ignore everything else. You're going to ignore all these other socioeconomic services. And the future, that is what really terrifies me. For the future, you're basically mortgaging the future. For the social services in the future are not going to be there, because if you're going to spend most of your budget, most of your tax revenue paying back debt, there's just very little left for social services, and the poor are ultimately going to suffer. But even in the present right now, as long as we don't address the question of both intellectual property, but also financing, if we don't address intellectual property, a lot of Africans won't get vaccines, and those who won't get vaccines will often be the poor. If we don't address the question of financing, you're going to hear proposals like we have had, that vaccines should not be free, that you should pay a fee. So you're going to have to figure out who gets left behind, and it's often the poor. It is often poor women, poor persons with disabilities who already have very little incomes. And just the last thing I would say is, within this vaccine conversation as well, has been the issues around access to information. I didn't include them here because I know we have very little time, but I will say it real quick. We are moving in the dark. The prices you get to know about is because someone has leaked it, right? Whether it is the countries, I think have been put under pressure not to disclose prices. If you recall last year, when someone from an EU country disclosed, there was all kinds of hell raised, particularly by pharmaceutical companies, that said she was violating the agreements. Now, in our African countries, which already have very limited access to information, usually have states that want to keep a tight control on everything. This is even worse. So there's very little transparency on everything, from vaccines, just how much is being paid. You know, the area now we know, but Kovacs has been a huge issue, just transparency there, which is what many of us are relying on. Transparency for how much African countries are paying. And whenever there's no transparency, we are the ones that suffer, but also the lack of transparency around things like efficacy. In Uganda, we've started rolling out vaccines, and a lot of people are very hesitant. They just want to know, have you gone and actually, like, what does the full data say? Can our country come before us? And how much are you paying? And are these vaccines? So the lack of transparency around that has definitely affected people's perception and willingness to have vaccines, which is a critical thing for us to think about. Yes, we are advocating for more vaccines. It is definitely a human rights issue, but for there to be equitable access, people also have to be willing to take the vaccine. So as long as there's very limited access to information, it's going to be a key hurdle. In Uganda's context, when some of us began to raise critical questions, particularly around who gets prioritized, will they be free, are there additional requirements, how much are we, let's see the actual prices, were warned about being anti-government. And so this is an issue that I want to flag for us to also discuss, because Mark started the discussion around how you build a movement and a sustainable movement for this. You are going to need people, particularly people who are also informed, to be able to be at the forefront of that advocacy, everyday people. And so the extent to which we can make sure that access to information is trickling down. Because without access to information, I remember I was on a show recently, like 2 weeks ago, and I was talking about the need to support the WTO waiver and the IP issues. And everyone was like, well, but people have to make business and so forth. And it's only until you begin to say, well, this is how much this country is paying, this is how much this is paying, this is why we are the last, that people begin to say, okay, wait a minute, why are we demanding this? We should at least start the movement here domestically in our country and make enough noise. That's when you can talk about things like access to compulsory licensing and get public support to say parliament or government, why aren't we moving on this issue? So we need to think about the three issues. I think definitely around increasing the supply, which is tying to both patents and also the sharing of the know-how, the issues around financing, and the issues around access to information, such that we are actually able to have a situation where the least privileged person in Africa is able to get a vaccine. And I underscore this because as COVAX rolls out and as African countries get these vaccines, there's been almost a huge sort of patting ourselves on the back as a world. Yay, we've done so well. Yesterday, I was arguing on Twitter with, I think it was a Today show, which sent someone all the way to Uganda, and they went to this remote island and they were like, look, Ugandans, in a remote village are getting vaccines. It's incredible. But they also do point out that at most it will be 1% of the population. And I thought to myself that there's something wrong with a situation where you're misusing facilities like Kovacs to pat yourselves on the back and say, look, we've done so well. We're going to put more money towards Kovacs. Everything will be fine. We are sidestepping the intellectual property issues. We are sidestepping the very problematic legacy that they are aware of that came from HIV, but also other epidemics. And we risk replicating them. So I think this is a very timely conversation. I'm glad it's happening with a specific focus on Africa, because I think these conversations have sometimes happened without Africans at the forefront of talking about them. So Aka, this is really great that you are leading in this. And I'm really excited to hear about, I wanted to get a bit into sort of the company's tactics, but I know those presentations are coming and I'm really excited to hear from my co-panelists. Thank you.
Thank you very much, Alana. I think there's a lot there to take in. And as the presentations go, there are more and more issues that we can come back to. Because of time, I would quickly want to invite Mona. Please make your presentation.
Thank you. Thank you very much for the speakers as well. Alana, that was really powerful. Thank you. And thank you, Mark and Francesca as well, and Aka for having us. For those who don't know me, my name is Mona. I work for ESCRnet. Introductions were done, but I just did want to say we are a member-led NGO, and a lot of our NGOs are working, or social movement members and NGOs are working on the issue of vaccine apartheid. One of the things that we are doing right now is working on a comic series on corporate capture. And we're going to have a second episode coming out very soon on the corporate capture of our healthcare systems, which is very relevant to our conversation today. And as Mark was saying, the conversation has been shifting between focus on healthcare systems and focus on the role of pharmaceutical companies and so on. And we're hoping to look at that a bit more holistically in this comic series, with providing a lot of background information. But to jump into our topic today, corporations, but pharmaceutical companies especially, are in many ways one of the main actors in the current play of affairs, if you will, to have hindered massively and inexcusably access to the treatment and prevention of COVID-19. And if you look back in history, as Mark said, Big Pharma has a trend of doing this. And looking specifically at responses to the HIV/AIDS pandemic, there are so many similarities with how corporations have prioritized making profits at the expense of people's lives, particularly in impoverished situations. I want to speak about a certain incident in 1999 with relation to HIV/AIDS, where there were leaked cables in the US that showed the extent of corporate capture or corporate influence on the price of treatment of HIV/AIDS, which essentially made medicine to treat this illness inaccessible and unaffordable for millions of people. And it was a big issue at the time, connecting the likes of the Vice President Al Gore, and then you had the White House Chief of Staff, John Podesta, and his brother, Anthony Podesta, who was the point man in Washington for the most powerful lobby in town, which is the pharma lobby. And so you had this very clear instance of corporate capture that essentially led to a real spike in the price of treatment of HIV/AIDS that really impacted people directly, and impacted their right to health. To speak about our topic today, the Secretary General of the UN called out the inequitable distribution of the COVID-19 vaccines, and he said it was an immoral global failure, as did others. But I think it goes far beyond that. It's in fact a legal failure, and actors, including private actors such as pharmaceutical companies, need to be held accountable for facilitating vaccine nationalism and holding up the equitable distribution of vaccines. So several major pharmaceutical companies, including Pfizer and Moderna and others, currently have this key scientific data that we need for the treatment and the prevention of COVID-19. And much of it, it is actually thanks to public money that was invested on this, government money, taxpayers' money. And simply said, this data should be shared freely and openly. There's no need to complicate matters. But it's not being shared, and this is the biggest part of our problem currently. And one would imagine that if this is a world where human lives are worth more than profit making, then states would have legislation to hold accountable companies for refusing to share life-saving information, but that is not the case, and this is not what we're seeing at the moment. Instead, we have so many states that are protecting corporate interests, and in part because of a manifestation of corporate capture that we call revolving doors, where many corporate employees have been or will be at some point government officials, and therefore will have a great impact on the government decision-making of public policies and laws and regulations that will likely prioritize profit-making over human rights. And a significant, another example, of how that plays out is that you've seen probably in some of the news that was shared publicly that a significant amount of the emergency funding for COVID-19 went to corporatists who had ties with the government. And we looked in some of our research for the comic at examples in the UK, in the US, in Kenya, and I'm happy to share more about that. But in Kenya, for example, in the KEMSA case, it was labeled by the international media as corruption. In the UK and the US, the same thing happened, but it, on a different scale, let's say, but it was essentially legalized corruption. So it goes unnoticed in the media, and unless we have laws to prevent this from happening, we're going to continue to be a corporate run or a corporate captured world. Another reason why vaccines are being treated as a commodity instead of a public good is because companies like Pfizer, among other giant pharma companies, have spent the last 25 years or so aggressively lobbying richer governments to put in place rules and regulations that would turn medicine into a traded commodity and our right to health into a business that will only cater to people who can afford it and to countries who can afford it, whether through privatized healthcare or privatized insurance services. And of course, countries with capital who can afford it, we're happy about that. They obliged because their system essentially, or the dominant economic system ultimately works in their favor. And to put it in plain words, the current play of affairs in terms of who gets healthcare when, like Alana was saying, the comparison between prioritizing because you're born in France or you're born in the UK, you get to have the vaccine before anybody who is born in Uganda or otherwise. To put it plainly, this is one of the most openly colonialist, capitalist, racist, and supremacist problems of our current reality. Just, calling it out as it is, essentially. In the case of the World Trade Organization, companies like Pfizer, along with other corporate elites in the pharma industry, succeeded long ago in their lobbying efforts to influence the adoption of intellectual property rights and patent protections. So what we're seeing today in terms of the TRIPS agreement, this is the lobbying efforts, millions, billions maybe over the years of dollars put in by corporate lobbyists to make sure that such agreements exist, and such agreements will actually serve to ensure profit making for them whenever we are hit by a pandemic, versus ensure that everyone gets treatment and everyone gets treatment at a reasonable time. And what's more concerning is that these pharmaceutical giants like Pfizer and others, they're not trying to hide the fact that they are openly, for the protection of intellectual property or vaccine patents. Last year there was a statement by the International Federation of Pharmaceutical Manufacturers and Associations that includes Pfizer, AstraZeneca, Johnson & Johnson, Sanofi, GlaxoSmithKline, and Gilead, all manufacturers of vaccines. And the statement essentially argued that patents and intellectual property must be protected, giving some of the reasons that Francesca shared with us earlier. And that was despite a clear call by civil society and impoverished countries and the World Health Organization to share information that would essentially save lives. If you look at websites of these companies, you'd be essentially shocked because the language that they use is human rights language, talking about the equitable distribution of vaccines and so on. But if corporations, these companies specifically, are truly dedicated to saving lives and equitably doing so as they claim to be on their very savvy websites, then scientific research and information should have been made accessible to all as soon as it was available freely and without any obstacles. And this is especially true because, as I mentioned earlier, a significant chunk of money going into production of vaccines is actually people's money. Like Pfizer BioNTech received 445 million USD from the German government, as we know, of last year. Which reinforces a lot of civil society's calls for all to see the vaccine as people's vaccine and as a public good that should be free and accessible to all. I want to touch upon the Kovacs Initiative as well, which I agree with Alana. The initiative is not without fault, though it is meant to accelerate the COVID-19 vaccination in impoverished countries. But in January last year, the Coalition for Epidemic Preparedness Innovation, which is a foundation involved in the Kovacs program, invested about 1 million USD in Moderna's coronavirus vaccine. But more than a year later, Moderna and its vaccine essentially is anything but accessible or affordable. And the company has sold most of its early doses to rich countries, whereas on the other hand, impoverished countries have been left entirely shut out. And all vaccine makers have been mostly entering into deals with rich countries, and only upon getting some heat with regards to naming and shaming, and that might actually impact their profit, have they started to take action in terms of joining Kovacs even later than they should have, or in doing these very how can I say it, like showy examples of how they want to to extend their vaccine to places like on the African continent by giving a very small amount of vaccines in comparison to what they should actually be doing. There's so much more that can be said about the role of companies, but I'm conscious of the time, so I won't go into too much more details. But I will reiterate some points that I made in terms of private actors really need to stop treating the vaccines as their private property. And instead, they need to realize it is a public good that has been, in fact, paid for in billions by taxpayers' money, government money, and the vaccine science needs to be shared openly. And there are already channels to do so, like the World Health Organization's COVID-19 Technology Access Pool that Alana mentioned. And we need more manufacturers on board. We need a global plan put in action to scale up vaccine production. And my final words in closing, I want to borrow words from Abatlali, or the shack dweller movement in Durban, South Africa. In a statement they issued in January, they say, and I quote, "Vaccines cannot be only for the rich. They cannot be a profit-making business. All medicines should be for all of humanity. They must be made free for all people. Medicine cannot be a business. This is anti-human. Medical knowledge should be organized like a library, not a business. And I think that really sums it up. Thank you very much.
Thank you very much, Mona. Yes, as I say, we are a bit behind time, but I sincerely appreciate how comprehensive you've covered the number of issues. And I hope that as we run a little bit out of time, people will still be here to engage with the discussion. So without wasting much more time, I would now want to welcome Professor Surya Deva, who is the Vice Chair of the UN Working Group on TNCs, Transnational Corporations. And please, Prof, you have 15 minutes as well. But I hope that within we'll still have time to come back to the discussions. Please proceed.
Thank you very much, Kata, and thank you for the invitation to ACCA and organizing this wonderful event. Excellent presentations by my panelists. So hopefully I will try to finish before 15 minutes because the groundwork has already been prepared by the panelists for me. And I would like to touch upon some of the challenges that Mark and Mona and Elena highlighted and why we are talking about those issues again after 25 years. So I think I want to start with that. So let us start with the context for me. So before I touch upon the issue of corporate responsibility to provide vaccination, let me start with the context. Why are we talking about this again and again? And I would highlight 5 elements of that context. The first is inequality. We may think that this pandemic has created inequality, but it is not like that. It has been there with us for many, many decades. And this new economic order has perpetuated and legitimized this inequality. If you look at the COVID-19 pandemic situation, if you look at the report of the Oxfam, the inequality virus, it tells us that the 10 billionaires in the world, they have accumulated more than $500 billion in wealth. And at the same time, hundreds of millions of people are forced into poverty and they're lost of jobs. So you have these 2 parallel worlds taking place at the same time, and our order allows this to happen. That is my first point. The second point is discrimination. I think the access to vaccine or medicine has always been impacted with the existing discriminations that we have in society. So based on gender, race, color, religion, migrant status, all these elements are going to impact the issue of access. But currently, it is likely that new variables of discrimination will be added. For instance, there is this talk of vaccination passport. Now, this idea of vaccination passport is going to enhance discrimination. So people who are not able to get vaccination, they may not be able to travel simply because they're not vaccinated. And I think this is going and taking discrimination to the next level. So that is my second point, that the people who are marginalized in society, the people who are vulnerable in society, they are likely to suffer more, even if vaccines are going to be made available in certain societies and certain countries in Africa or in Asia or anywhere in the global south. The third variable that I would like to highlight is the privatization and commodification of human rights. Whether we talk about health, education, housing, water, or take it even civil and political rights. Let us say access to social media information. So if you do not have a good quality access to internet, your right to information is harmed. You cannot express your political opinion. If there's a digital divide, you cannot access education, right? So everything has been commodified, and only rich are able to access these rights, which are supposed to be available to everyone by virtue of being a human being. So that idea of human rights being universal and available to everyone is incrementally changing significantly And this is not an accident. This is happening. And what we see in the COVID pandemic is just mere reflection of that. My fourth element of the context is that we have hard rights. By hard, I mean legally binding rights for businesses, but only soft responsibilities of businesses when it comes to human rights. So when it comes to trade and investment law, these companies are able to enforce their legally binding rights, and the TRIPS is a reflection of that. So intellectual property rights are legally binding. But when it comes to human rights, of course, international standards, most of them are very, very soft guidelines rather than hard binding obligations. Of course, we can articulate that the constitutional law imposes binding obligations directly or at the horizontal level, you know. But if you look at the international paradigm, it is mostly hard versus soft cleavage that we can see. My fifth and the last point of the context is that there is a state business nexus. And I think Mona highlighted it in a different way, but I would like to frame it as a state business nexus, which is very deep. So what we see in terms of a lack of political will on the part of the states regulating businesses, what we see in terms of corporate capture, what we see in terms of lack of transparency, this is not an accident. This is a result of a tremendous amount of nexus between the state and the business. And if we have this pandemic in this wider context, what we see in terms of the inequalities, in terms of access, affordability, this is a good recipe because of these 5 variables that I mentioned. Now let me talk about the business responsibility now. And I will focus on 3 international standards that could be relevant here. First of all, I would like to refer to the former Special Rapporteur on Right to Health, Paul Hunt, and let me call it Hunt Guidelines, which were issued in 2008. And I think in the context of the access to COVID-19 vaccines, those guidelines are very, very relevant, but I don't think we are making enough use of those guidelines, which were presented to the UN General Assembly in 2008. I will just highlight 4 elements of those guidelines for your consideration. First is, it talks about very clearly that businesses, pharma companies included, they have to respect the right to the highest attainable standard of health. It's very clear there. The second is they talk about particular attention to the disadvantaged people in society. The third element is that they say that the businesses should not prohibit or do anything which prohibits or discourages states to use the TRIPS exceptions. For instance, pharma companies should not do any lobbying with the states that these waivers or exceptions should not be used. And the transparency issue was highlighted, so they also cover transparency. There are many, many elements of it, but I would like to bring back the Hunt guidelines. They should be fundamental to this discussion at this particular point of time. The second international standard that I would like to highlight is, of course, the UN Guiding Principles on Business and Human Rights, which were adopted in 2011, so almost 10 years old document, very authoritative, almost accepted by all the states. And I think, look at the paradox. The countries which are opposing the waiver proposed by South Africa and India, these are the countries which are strong supporter of UN Guiding Principles. And I will encourage all of you to look at Principle 10 of the UN Guiding Principles, which talks about that when states are negotiating in a multilateral setting, they must ensure that those institutions do not discourage or disallow the capacity of states to protect human rights. So if the waiver is not granted, then this is going to be in breach of Principle 10. So if the states which are supporters of UN Guiding Principles are opposing the waiver, they have to justify how does it sit with Principle 10 of UN Guiding Principles. So I wanted to make this broader point about the waiver. But of course, when we talk about the business responsibility, they have to respect all internationally recognized human rights, including the right to health and right to life, which means that businesses may cause, contribute to, or be directly linked to adverse impact on human rights, including right to health. And I think all these three possibilities of linkage are possible. Of course, they could be a pharma company which is pricing the vaccine at a premium price and many people cannot afford it. That is one situation where they could be adverse impact. But what about airlines? If airlines start lobbying the governments that they should introduce the vaccine passport, this is going to have impact on human rights as well, right? So I think we need to look at holistically different dimensions and the roles of businesses, how that is going to impact what they do in terms of adverse impact on human rights. And of course, the guiding principles expect these businesses to conduct continuous human rights due diligence. I don't have the time to go into it, but I think if we bring the human rights due diligence as a key component and remediation, I think that should be something we should be demanding and expecting from these businesses. The third international standard that I would like to highlight is SDGs, Sustainable Development Goals. Let us not forget them. And I think here, SDG 3 and 17, at least, are directly relevant. If we look at target 3.B, it talks about access to affordable medicines and vaccines. And 17 talks about public-private partnerships, global partnerships, technology transfers, and the need to mobilize additional resources, especially for developing countries. So I think those sustainable development goals should again be brought to the picture and highlighted and underlined that the issue that we're talking about is something which has already been committed. And I think the test, whether these SDGs do really mean something, are they real, is the pandemic. If the global partnership cannot be put into practice now, when we will do it? Because this is the crisis that we're facing, the global humanity is facing this common crisis, right? So let me conclude by saying that this is an unprecedented crisis. But I would like to connect it with what Mark was trying to highlight, the bottom-up approaches of building movements and social movements. This is absolutely critical. And I would say 3 points here. First is we need to reinstate rights. I think rights are losing their power. And they're losing this power under this globally interconnected neoliberal economic order. So I think we need to reinstate rights. So access to vaccine is not a charity, it is a right, it is a human right. And that imposes binding obligations on the governments, not just to its own population, but at the international global level. And it also imposes obligations, in my view, on businesses which are manufacturing those vaccines. So reinstating rights is the first thing we need to consider. Second is we need to recover the state. I think a state has been lost, it's losing. So a state is governing only for 2% of the 5% people who are sitting on the top of the pyramid. It is not governing for us, all of us. So we need to recover the state. And I think we need to bring these issues as part of the political process. And I think building movements bottom up is absolutely vital. Law has a role to play, but law alone will not be enough. My last point is that we need global collective action. Human rights are often regarded as territorial, but we should not forget that many of the challenges in today's time will require global collective action. This pandemic is a concrete example of it, but of course we can talk about climate change as well. So if states act only within their borders alone, and all of them act, even that will not be sufficient. And that is why we need to create this global collective action, not only on the part of the states, but also on the part of us, the holders and bearers of human rights and civil society organizations, academia, and everyone. I will stop here. Thank you very much once again for the opportunity.
Thank you, Prof. You've actually been right on time. In fact, you've saved us about 2 minutes. So I sincerely appreciate your brevity, but still being able to highlight some very fundamental issues that have come up. I was looking out in the chat to see if there are any specific questions. I don't note any. We also don't have a lot of time. We've pretty much run beyond the half hour that we had hoped to finish at. So we have a very little time left. And I think in fairness, it's rather that I should hope that even the rest of the speakers have been following up on what is going on in the conversations in terms of the points that people feel that were made that were very important. I will give an opportunity to the panel to perhaps come back on any of the issues that you still feel that you would want to make. That would be maybe in a minute or two. I feel that there are certain themes that have been running through the presentations. We did start off with a very principled discussions around the rules, the regulations, and the limitations that come from that. But I think in the course of the discussions, we've also started to see the need to bridge conversations between corporate interests and the human rights concerns, which are very real and very high in relation to the COVID-19 crisis, but also need to learn from other similar crises that we've either dealt with, such as the HIV crisis, and the lessons of that, and what has been lost, and why are we still having this conversation in 2021 when we've had a run of more than 20 years of another epidemic that we would have learned from, and some things have not changed. And then I think the other thing that we see that is coming through is the emphasis and the call on collective action and citizen activism, the need to reinvigorate and to rethink the role of citizens who are informed enough to engage government and to demand accountability, both from the corporates but also from the state, in as far as access to vaccines is concerned, narrowly but broadly access to protections related to medicines. And I think it is very important for us to have this conversation because, quite frankly, and has been said by scientists many and many times, this COVID-19 is probably a rehearsal crisis. We probably have many more to come, and we cannot get to this conversation every time a new pandemic starts and then we start talking about trips and waivers and corporate responsibilities and all that. So I'm informed that there's a question. I think the question is anyone using divestment strategies to mobilize international public grassroots campaign? I'll repeat it. Is anyone using divestment strategies to mobilize international public grassroots campaigns? It's an open question to the panel. If any of you feels that you can respond to it, I can ask you, Benjamin, to please post it to everyone so that the panel can also reference it. So I will just proceed to give the panel an opportunity to come back, maybe also respond to that question, if you will, for at least like two minutes. Then we can close it up. I'll start just as the same order that we used. So I will, unfortunately, Francesca, I think that means you are the first person. So please feel free, 2 minutes.
Okay, thank you very much. I made so many notes. Thank you for all the presentations. It was very insightful and very different perspectives. So I enjoyed it very much. Let me just make a point to the last one now when Surya said about the Principle 10 of the Business and Human Rights. It prompted me to think on Article 66.2 in the TRIPS agreement. And I just opened it whilst you were speaking, which actually poses an obligation on developed country members to provide incentives to enterprises and institutions in their territories for the purpose of promoting and encouraging technology transfer to least developed country members and so on. So there are, even in the TRIPS agreement, obligations that are actually not fulfilled. And if you take that serious, exactly in a situation like this, specifically technology transfer would be basically an obligation to actually enable, which is interesting. Also, when you, and I remembered that during the panel, the EU actually has waived all the IP rights within the European Union last week because of manufacturing capacity, a lack of manufacturing capacity. So they do that themselves within the EU, but block it at the international level, which I found quite shocking coming from one of those countries. And a thought on the long-term trips and problems, and Mark also indicated that it's a long battle. The provisions are completely skewed for what you want to achieve as a purpose. And maybe there's a reminder necessary that these provisions are only in place since 1995. That means before, there was no compulsory license necessary. There was no intellectual property protection at national level, actually an obligation for. So we could have done what we want to do with the waiver 1995 without actually having to have a waiver. That was just a point, and there are some WTO previous, even appellate body members who are saying that the right balance is there at the TRIPS agreement. And I think that is the fundamental problem, that just because it's law at the moment doesn't mean it was actually the right balance, unless you agree that, it's always the question, what is for you the right balance, and what are the actual interests that exclusive right should pursue when you take into account private, public, and government interest. There were many points I had here. Let me close just with, yes, the waiver is within the system, and it's, as I don't know if I've said it, but it's not even tabled at the ministerial conference, despite it had to be after 90 days from the TRIPS Council, according to the procedures law. And that is because of the blocking of those countries. And 100 countries, 100 developing countries are actually behind the waiver. And we would only need 123 to vote for it in order to get it into place. But it's not tabled at the right places. So I leave it there if there's no question. So do others have far more insightful things to say now?
Thank you very much, Francisca. Mark, please.
I want to just thank the organizers and the participants for organizing a great opportunity to exchange and share ideas and experiences. I hope this is a beginning and not a once-off and an end. I think that the impact of COVID-19 on Africa is grossly underestimated. The fact that we are not reporting mortality rates similar to some of the developed countries or infection rates, I think is more to do with our health systems capacity than it is to do with the reality of the impact of this virus. In South Africa, for example, although our official statistics around deaths are around 50-something thousand, the actual excess deaths now has reached 150,000 excess deaths above the average in a year. And there's no reason to think that that is not happening in other countries. This is breaking our health systems. It is setting us back on diseases like HIV and tuberculosis. And it is a threat to equality and a threat to development. And I think that must infuse us with a sense of urgency. I would just say two things. One is that what I've really enjoyed about this seminar is the opportunity to share across Africa. That must happen. It must continue. Even just hearing from Francisca just now that, there's only another 20 states that are needed to get the required 120 to get this proposal onto the Ministerial Council agenda is not something that is widely known or widely understood. We haven't been able to get this down to grassroots movements or its full implications, but that becomes something we can mobilize and we can organize much more effectively around. So information sharing is so critical. In the AIDS epidemic, we set up something called the Pan-African Treatment Access Movement, which meant that we talked across borders. We need to do that again. And the last thing I would say, just which I think has been the theme of all of us who've been on the panel, but to agree with Soraya, is just rights have to be at the center of this. All of our governments have committed to international covenants on economic, social, and cultural rights. We built socioeconomic rights, the right of access to healthcare services in one form or another into our constitutions, and yet we allow our states and the private sector to behave as if there is no such legal framework in existence. We have to make this legal framework work, and we have to hold the private sector accountable for it. So really just thank you very much for the illuminating presentations and for the opportunity this afternoon. Thank you.
Thank you very much, Mac. Also listening to your experiences and sharing, you know, the lessons from the HIV movement. I think that has been an eye-opener for a lot of us, and also for those others working in the field generally. I think it will inform how we go ahead. Alana, please. Alana?
Sorry, I keep forgetting to unmute. Yeah, it's been so fascinating, and it's a shame we don't have time to engage with everyone, but I wanted to respond to the question on divestment strategies. I think those are some of the ideas we need to sit and put our heads together. Because like I said, the companies have really pitched this to their investors. They're waiting for the windfall, and it's all good. They are winning by saving the world, and they're going to get the money. And maybe that's not some of the more
Oh, sorry, I think, Alana, we lost you a little bit.
Naming and shaming rights issue. And hello, am I back? But I also wanted to quickly say that in conclusion, that I do hope that there's a lot of sharing. I do think it's very important that as an African group as well, that we are speaking about this. When my friends started talking to me a bit about this in the States, they all get, you know, my classmates saying they're getting vaccines and so forth, it never even occurred. The injustice was not real, because they were not seeing. It was all hypothetical. Now the numbers have come in, like I said. We have the countries that haven't even started being vaccinated. We have the data. We have the fact that we know the vaccines we are getting are not necessarily the safest right now. If you look at what has been happening today with AstraZeneca and Fauci and all kinds of things. So there's a lot of things that are there, and I think we need as a group to have more conversations beyond this. We need to have more aggressive strategies. We need to build grassroots movements, particularly because this is not the first wave. I just saw today that Germany is going back under lockdown until after Easter. And those guys started vaccinating like a while ago. So this is like a rehearsal of how badly things could get. And so we need to make sure that we sustain the pressure. Mark said something about this being long-term. And I think that's also very important for us to think about, because right now we're doing a lot of tweeting. Some of us have been figuring out, okay, who is blocking what? We haven't interrogated a number of institutions around financing. And just to plug for you, the World Bank Spring meetings are happening this week. So come and hear the conversation we'll be having with ISA and a couple of other organizations on the people's vaccine at the World Bank Spring meetings, with a specific focus on the role of a powerful player like the World Bank. And so I think we need to do a lot more of that, like segment and say, this is the player, this is the company, and then ask our own countries to be vocal. We've been asking Uganda to speak out about the need for people's vaccine, and they're not doing so. Yes, the AU has mentioned this and so forth, but it would have been very powerful for my country to come and say, listen, this is the impact. I saw someone from Nigeria saying that she's just very worried that the vaccines will never trickle down to people. And they won't trickle down to people as long as there's no supply, and as long as we don't address the financing questions around this, which are two very critical things. And so I think we need to do a lot more strategizing, such that, you know, we are sharing ideas and information, and mapping out the different players. It is ultimately a human rights issue. I agree with all the panelists. We raise this.
Sorry, Alana, we lost you again.
At the Human Rights Council, and we're asking to have something that shows really the importance of this as a human rights issue. So we need to see that come through more. And I couldn't agree with Mona more. There's just been a lot of state capture beyond this process, Mona and the other speakers, beyond this process, just in terms of thinking about, will the state actually focus on the needs of its citizens? For many African countries, the reality is no. So there has to be a lot more strategizing, and I hope this is not the last conversation. Thank you.
Thank you very much, Alana. I think the issues are becoming more and more, like, the more we emphasize them, the more we realize how important it is that we actually paying attention to all the dimensions that range from mobilizing to just understanding the frameworks, to understanding the institutions and the role players, and having an opportunity to engage each of them, at the point of the language that they understand. And I think the key takeaway for me, particularly on that, as far as states are concerned, there are certain languages that states understand that probably sometimes we may not be speaking them in terms of applying pressure for them to come up and embrace their responsibility. So I hear the need for more conversations, particularly in the African region, so that we have a united voice. I would invite Mona, please.
Thank you. Thanks very much again for this really important panel and for all the panelists' contributions. In response to Donna's question with regards to divestment, I think divestment strategies can be very, very powerful. And in response to apartheid in South Africa, the BDS strategy was a very real example of how divestment can work, how companies follow the money essentially. And I wanted to raise the example of Palestine specifically because we haven't really talked about that specific case where vaccine apartheid is taking place on a different level, where it's not that vaccines are not available for Palestinian people, but it is that the Israeli government is choosing not to offer it to Palestinian individuals. And I highlight this because there has been efforts to contact Pfizer by Al-Haq, which is a Palestinian human rights organization, and they raised their responsibilities to the equal distribution of the vaccines and to, talking about the right to health and so on. But it's been completely ignored. And the reason is because, I don't think companies will respond to voluntary initiatives or, letters that will essentially say, generally you have a responsibility without any sense of a legal accountability attached to it. And I think that means that we just have to work on strengthening our legal system, international legal system, to ensure that where corporations are not, are contributing or causing to massive failures in human rights for individuals around the world, they are held accountable to it. So I think I would stop there. And say, in the end, I think I agree with a lot of with what has been said in terms of we need to take back the power. We need to build from the ground up. Social movements, grassroots movements need to be prioritized. Our rights need to be prioritized. And those who are standing in the way, like corporations or states who are working for corporate interests, need to be held accountable and prevented from doing so.
Thank you very much, Mona. Surya?
Thank you. Very quickly, 2 points. In response to the question, I would say that in addition to divestment, we could also think of shareholder activism. So shareholders can continue to be in those pharma companies, but they can use their leverage in a positive manner to push for the change from the inside. So that could be an alternative. So it's not either or, but I mean, we can try what works in certain situations. But the last point I would like to make is that I think we should also try to unpack this myth that the TRIPS or the protection of intellectual property rights is needed for invention. There is no necessary correlation. If you look at the greatest inventions that we have seen in civilization, they were at the time when there was no protection of intellectual property rights. So people can still invent. They have invented for centuries, in fact. And those inventions, all of us are using them without any protection of intellectual property rights. So I think we should also build a narrative that intellectual property rights may be necessary, it may be an incentive, but it is not an absolute precondition for invention. And in any case, it must always be subjected to human rights obligations. Thank you.
Thank you very much. We have only 2 minutes left, and we are under. We would not want to extend beyond the top of the hour. So from my side, I think I just want to take this opportunity again to really sincerely express our gratitude as ACCA, but also as the Center for Human Rights, which hosts the Secretariat of ACCA. We really, really sincerely appreciate your time and your expertise and research and investment in this webinar. Thank you very much to each of you, for the panelists, and also for the participants who have been there listening and contributing and discussing. We are very grateful for your time, and of course also to the interpreters. Thank you for bearing with us, and apologies if we have been too fast in some cases. Thank you very much for keeping the conversation going. And of course, to my colleagues from ACCA and the center as well, those who are supporting the hosting of the workshop in the background, to Liz, to Tiruna, to Benjamin, to Telma, and all the others who are in the background. Thank you very much. This is really just a note to say we sincerely appreciate your time and your effort. I get a lot of questions I'm seeing rather some questions about the presentations. We will reach out to the specific panelists on the presentations that you may have used. We are hoping that if we can get those, that they will be posted to you. So please, pardon us, we may not have shared this right away, but we will try to share them with you. Again, from my side, it's a huge word of thank you, and keep well. Enjoy your respective morning, afternoon, or night, whatever it is. Thank you very much, and we hope this conversation will continue. Unless there's something from your side, Benjamin, I think we would close.
No, you have said it all, Nkata. Thank you very much for brilliantly moderating this session. Yeah, it was a great pleasure, and thank you, everyone. We will follow up on this conversation.
Thank you. Bye-bye.
Thank you. Bye-bye.
Thank you very much. Bye.
Bye.
Bye.